Welcome to SG Health and Wellness. I'm Swati, Doctor of Natural Medicine and Holistic Nutritionist. Once again, we have the privilege of speaking with Dr. Prashaant Chaudhry, a renowned and best ophthalmologist in Delhi with over 19 years of experience in the field of eye health. Dr. Chaudhry, a warm welcome to SG Health and Wellness.
Thank you so much, Swati.
Today's episode actually is all about nutrition and eye health. So, can you please tell us how does a person's diet impact overall eye health?
Thank you very much for having me here, Swati. I would like to tell the viewers that Swati herself is a very renowned nutritionist and she has cured herself of diabetes just by nutrition.
Correct.
She used to have uncontrolled sugars on many medication and slowly her sugars came under control and now the medication has also stopped.
Yes, for the last 2 years,
2 years,
I am
no
not taking
medication.
any medication. Yes.
So that is the power of nutrition. Nutrition is like almost, you can say, nutraceuticals. That means you have pharmacy drugs, you eat a drug, the drug affects the body. Medicine is formed from products like plants and animals. So the food that you eat is also going to affect your body, not just as a nutrition like, the fat, protein, carbohydrate, but if you go a little deeper at a genetic level, the food will influence the way that your cells behave. So in the eye, nutrition is very, very important.
Correct.
There have been huge studies of thousands and tens of thousands of patients which have proven the effect of nutrition in the eyes.
Mhm.
So whether it is age-related changes, whether it is digital eye strain, whether it is dryness of the eyes, whether it is, myopia, a lot of things,
Retinopathy, cataract,
cataracts, diabetic retinopathy, all of these, there is an impact of nutrition.
correct. I myself experienced that actually.
Yes.
And
Swati's retina also, there were some spots of diabetes starting and then they
Exactly.
have disappeared.
exactly.
So listen to this talk very, very carefully.
How can nutrition play a role in preventing common eye health like age-related macular degeneration?
Yeah. So age-related macular degeneration is a disease which happens after 50 years of age. The retina is not protected by the pigment so much in certain people. And because of that, the blue light affects the retina and the retina starts degenerating. It causes swelling, it causes permanent vision loss. We may need to give multiple injections into the eye every month for many years. Now, a study has shown that there is a combination of antioxidants which are going to protect the retina and prevent ARMD. The most important of these are lutein and zeaxanthin. Now, these are not artificial products. Lutein and
Correct.
zeaxanthin are present in a lot of things that we eat. Lutein is present in spinach, in kale, all these green leafy vegetables. And zeaxanthin is present in eggs, again, good quality eggs. The chicken has to eat the zeaxanthin for it to have it in the eggs.
Correct.
So, good quality eggs which have a lot of yellowness in the egg, maybe the brown eggs, and corn. These are the things which have more of
Bell
zeaxanthin.
pepper also.
Yellow bell pepper.
Correct.
See, we have it's very nice to have a talk with someone so done it. Yellow is the color of zeaxanthin.
Oh,
Now, zeaxanthin is produced by all leaves to protect the leaf against excessive sunlight. And the moment sunlight goes, it converts the zeaxanthin back. So yellow structures have permanent zeaxanthin. So that is why we should eat the yellow things like yellow bell peppers, yellow corn, and spinach also has zeaxanthin. Now, like the way they're protecting the leaves, the zeaxanthin comes and protects our retina. It makes a blue light filter in the retina, and in addition, it is a very, very powerful antioxidant. Other than that, it has been proven vitamin A, E, and C. These three are very important in ARMD. Now, if we come one by one, vitamin E and the zeaxanthin, the antioxidant, are synergistic. Synergistic means 1 plus 1 equals to 3. Not 2. And 2 is addition. So that means in your diet, if you're having a lot of green vegetables, but you don't have enough of vitamin E, then the protection is not so good.
Not so good.
So you should have sources which are rich in vitamin E as well. Along with that, vitamin A and C. C is required to regenerate the vitamin E. Then zinc, copper, selenium. So this cocktail was proven to be very, very effective in preventing age-related macular degeneration. It is present commercially as many capsules, and in our diet as we go along, we'll see what are the rich sources of each and every one of these.
And for individual with diabetes, how does nutrition affect the risk of retinopathy, diabetic retinopathy?
Now, diabetic retinopathy is a condition where there is a lot of role of inflammation.
Correct.
There is going to be closure of blood vessels, and later the inflammation is going to cause the swelling. It is going to cause closure of blood vessels. So it is not just high sugars. High sugars make it an inflammatory state.
Correct.
So again, the antioxidants and omega-3 fatty acids are also antioxidants.
Correct.
Now, incidentally, vitamin A, E, omega-3 fatty acids all are very rich in cod liver oil, in sea fish.
Flax seeds.
Flax seeds has omega-3 fatty acids.
Correct.
For vegetarians, flax seeds, walnuts. These are the two things that you should have every day for omega-3 fatty acids. It is going to help you from dry eye. It is going to help you as an antioxidant for your eyes, for your heart, for your joints, for everything. And
for non-vegetarians,
cod liver oil, eggs
and salmon fish also.
Yeah, all the patients in Delhi say, where will we get sea fish from? We have only river fish.
No, actually, salmon fish is available nowadays.
It's available.
It's available nowadays.
I'm vegetarian, so yeah, I'll take your word for it. You can just shed a light on how to control sugar by nutrition.
Yeah, sunlight every morning, at least 5 to 10 minutes of sunlight. That is more important for us
Vitamin D, yeah.
For eye health, actually. For eye health,
yeah.
That is the natural vitamin or
word
whatever
of
you
caution, you should not directly look at the sun.
No, in the early morning sun, actually.
Very early morning, through the lashes and all, maybe yes. But some people will look at the midday sun and they'll burn their retina. So that is why with a lot of caution it has to be done.
Yes. That is not recommended in the... see, when the sun is just rising, the early morning around in Delhi, 5:30, 6 o'clock, 6 a.m. in the morning. That time sun is not harmful actually.
Yes.
It's good for health.
So you have to wake up very early and see it in a very, very cautious way, not in the daytime.
So,
but you know, there's one more thing. ARMG and diabetes, both, if you're obese, you're going to get them.
correct.
There's a higher chance. And there is a very interesting aspect to this. If you do some moderate exercise, your body gets oxidative stress and natural antioxidants are produced.
Correct.
Even if you eat all of this, a very good diet, and you're just sitting on the couch all day long, your body is not going to produce the antioxidants that it needs. Regular moderate exercise can make your body a source of the good stuff.
And
that will prevent you from having age-related macular degeneration, cancers, heart disease,
correct.
all of these.
Overall health.
Overall. Like we are talking about lutein and zeaxanthin. Now these work at a genetic level as well. They will go attach to the cell membrane, send a signal. If it is a cancer cell, it will cause death of the cell. If it is a nerve cell or a retinal cell, it will cause that cell to survive. If it is dying, it will cause it to become alive again.
Correct.
So all of these things work very synergistically. So diet, along with that, moderate exercise is very important.
And one more thing I want to add, that every after 45 minutes or 1 hour, every person should walk or minimum stand up for 2 to 3 minutes or 5 minutes is recommended.
Real would be every hour walk for 250 steps.
Exactly.
If you can do that, you're going to...
Sitting for long is the most harmful part.
So everybody get up, be active, have moderate exercise. You should be a little breathless, not just strolling. Fast walking, if you're more fit, jogging, if you're more fit, running. But do that for at least thrice a week, 1 hour. That should help.
Even 20 minutes 3 or 4 days a week, strenuous exercise is recommended after a certain age is very important.
And not too strenuous. I would suggest that don't make it go overboard. Moderate is good. In fact, if you eat too many antioxidants, then again, there's no protection from disease. It helps, then the helpfulness is gone.
Exactly.
So everything, consistency
Is
and
important.
in moderation.
Exactly.
These two things
Consistency
are important.
is the most important thing. And how important is hydration? Hydration for managing eye health and any other related to eye.
So hydration is very important in getting rid of all the toxins from the body. So if you have enough of water, all the your kidneys are active. They are able to excrete all the oxidative stress, all the harmful toxins which are going to cause damage to every part of the body. So hydration will help you in general by reducing the oxidative load, and it will help you in your dryness, it will help you in your retina. Overall, it is excellent for the body. You should have at least 3 liters of water every day. I have this kind of a bottle. So this, every hour it tells me that I have to drink this much.
Wow, that's
So
great.
have something to remind you.
Remind you. That is
And
good.
along with that, there are also some things you should not do. Everybody knows, don't smoke, don't have too much alcohol. So these are the things which are harmful for you, and
bad habits.
bad habits. And pollution is also a bad thing for us, but it's not a habit, it's a compulsion for most of us.
Exactly.
So let us negate that. What is in our hand is exercising, having a diet which is rich in all of these things. Let us negate it by doing positive things.
Can you please tell us what is glaucoma and what are the
Dietary things related
dietary
to
things, and at what age that glaucoma will come, or is there any relationship between diabetes and glaucoma?
Yeah, so there are many aspects to that question. Glaucoma can happen even at birth.
What is that actually?
Glaucoma is when the pressure inside the eyeball is high.
Okay.
That pressure is high. Now imagine you have a tire of a car and the pressure is supposed to be 30. You make the pressure 90. What is going to happen? The wheels, the threads are just going to give way and everything will go bad.
Okay.
In our eye, the pressure should be between 8 and 20. Now, if the pressure goes to 30, what will happen? The nerve will be permanently damaged. So you'll be seeing well, but your sight vision will slowly come down till you have a tunnel vision. And that is when you will realize that, okay, something is wrong. And you will have lost 90% of your vision permanently. There is no cure for glaucoma. If you have lost 90% of your vision, we cannot make it even 89. We will stop it so that it doesn't become 91. But we cannot recover even 1% of vision lost due to glaucoma. Which is why it is very important that we should have periodic checks. After the age of 40, everyone should have an eye checkup done at least once a year, so that this is caught in a very early stage. And with the treatment, we stop it at that stage. Let's say we catch it at 10% loss. 10% loss we'll manage easily, and we will prevent it from going worse. Now, the dietary things related to glaucoma, one very interesting test that we do in glaucoma is we make the patient drink 2 liters of water. And if the pressure goes up by 25% or more, that means that he has a tendency for glaucoma. Most glaucoma patients, if they drink a lot of water at the same time, will have the eye pressure go up. So glaucoma patients should drink water, but not a lot at the same time. Have 1 glass after an hour, have another glass. Every half an hour you can keep drinking. At the same time, drinking too much water, your pressure will rise. Then tea and coffee causes pressure rise. If you have glaucoma, have moderation in your tea
intake. That means anything related to fluid, too much fluid.
Not just fluid, caffeine. Decaffeinated coffee will not cause pressure rise, because it is just a small amount.
But you are saying about tea also?
Tea also contains caffeine. But green tea, on the other hand, that has antioxidants, and that brings the pressure down. So those of you who can do it, shift from tea and coffee to green tea if you have glaucoma. That will help in control the pressure better. Then some other things that people generally do not understand about glaucoma: if you are doing Shirshasana, that means your headstand, your head is down, your legs are up.
Blood, sir.
Your pressure in the eye will go up to 60, 70, 80. because all the pressure is being transmitted to the eye.
Oh.
So patients with glaucoma should not do that.
Not.
Normal patients, yeah, it's the king of all asanas, Sheshasana.
Exactly, king of all asanas.
Yeah, so it is a good asana, but not for people with glaucoma.
It's a new thing, new thing come to me. And what is the relationship? Is there any relationship between diabetes, high blood pressure, and glaucoma?
So diabetes is not a cause of glaucoma, except for a very advanced stage when diabetes affects the eye so much that blood vessels start forming all over the eye. Then we have a form of glaucoma which we call neovascular glaucoma, which is very difficult to treat.
Okay.
But other than that, if you look at the general population of diabetics and you say, how can I have glaucoma? I don't have diabetes. That is absolutely incorrect.
Okay.
There is only a little bit more risk if you're a diabetic to have glaucoma. Otherwise, everybody has a risk for glaucoma.
Okay.
Don't think I don't have diabetes, I can't have glaucoma. Most people with glaucoma don't have diabetes.
Okay.
And hypertension is again certain very in the in the complication stage of hypertension affecting the eye, like vascular occlusion. Then the pressure will rise. Just hypertension will not cause glaucoma.
Okay, so there is no direct link between these two and glaucoma.
Yeah, not a very mild link is there with diabetes. Advanced stages, very strong link. But generally, even without diabetes, you can have glaucoma.
It can come to anyone. Okay. So, what is the general recommendation obtaining nutrients from whole foods and supplements?
Yeah, so vitamins, vitamin B, zinc, all of these are present in whole foods like whole grains. Instead of white bread, nowadays you get whole grain bread that has a lot of grains in it. If you can have pumpkin seeds, if you can have sprouts, chia seeds are very good. These are very rich sources of zinc. But zinc is not very easily absorbed from sprouts because they have phytates. So if you can soak it, you can sprout it instead of having the pulses directly. If you soak it, then the absorption of zinc is much better.
Okay. And what about supplement instead of taking that whole foods or sprouted foods? Is it better than the whole food?
Whole food is always better.
Always better.
Because sprouts they will give you vitamin C, they can give you proteins, they can give
much
you
more than zinc only.
Fiber. They're like the natural thing. For millions of years, our body has been taking those, and it is used to those. Now, if you take a supplement, it is just zinc, nothing else.
Zinc, nothing else.
So those are also required. If you have ARMD, by all means, take those supplements. But otherwise, I think just be more careful with your nutrition. That will help.
Right. How do you educate your patient about the importance of nutrition?
Oh yes, I spend all my prescriptions will have a list of things which they should be eating. If it is someone with ARMD, they should have amla, vitamin C, they should have spinach, they should have carrots, they should have eggs if they are non-vegetarian. These things are important for age-related macular degeneration. But a word of caution here, if you are a smoker, then too much of vitamin A can cause lung cancer. So stop smoking. If you have ARMD, stop smoking. That will affect your retina a lot. And then have vitamin A. Otherwise, don't take supplementation of vitamin A. Don't take too many carrots and vitamin A rich food.
Very rare doctor gives the advice of taking food.
All my dry eye patients, walnuts, flax seeds.
They only recommend you should
It comes printed. I've got direct things. I just click a button, it will come because I know they need it.
Exactly.
And it will really help.
Really help.
I can look at someone's eyes and tell, you've been eating a lot of walnuts, haven't you? I say, yes. Because their eyes are so moist. All the glands producing the oil is so beautiful. It's rare.
Yes, I experienced that.
I have told you as well. You're eating something very good.
Correct.
So I can
started
see
eating after you told that you should take a little bit more. I used to take, but I started eating a little bit more walnuts after told
the next time I found it, I could see that the effect has come. So it does make a big difference.
Correct.
Also, fruits are very, very important. Fruits are nature's gift to us. They contain so many antioxidants, vitamin A, vitamin C.
Correct.
The fruits like cherries, like blueberries, these are loaded with antioxidants. They have a lot of vitamins in them. Strawberries have a lot of vitamin C. Papayas have a lot of vitamin C. Guavas have a lot of nutrients. Berries in general are very, very healthy. I think you will want to add something to this.
Exactly, strawberries, and the most important is blueberries. Blueberries are the
So have a little bit of blueberries, a little bit of strawberries, a little bit of other fruits, seasonal fruits, and nuts.
Correct. Nuts.
And flax seeds, walnuts, all kinds of nuts. Have all of these throughout the year. They will make you feel less hungry,
Exactly.
and they will enrich
Exactly.
enrich your body by giving antioxidation, making it healthy.
Any other final recommendation you want to add? No.
Yeah, I think if we summarize it, first, reduce weight, do moderate exercise regularly. That is going to help in a lot of manners, much, much more than what you think. It's not just weight loss, it is the milieu, the antioxidants in your blood and everything, which are going to be so much higher, and the health will be so much more. Second, smoking and alcohol should be avoided. Drink lots of water. Have antioxidants. Antioxidants are there in like egg, yellow capsicum, spinach. Then have walnuts, flax seeds. Keep all of these as part of a diet and keep them there regularly, every day, because they will complement each other. If you have too much of one thing and nothing of the other, it will not help.
Right.
You should have, they complement, they're synergistic.
Balance is important.
Yeah,
and what about eye exercise and all?
Eye exercises is something which allopathy is not very clear about. There is no harm at all. We tell the patients, by all means, do all the exercises you want to. You can do rotations, up, down, look at the pen, bring it close. That is very good for children. They have a lot of screen usage, so their eyes become weak. So if they take a pen and look at it, then take it far, bring it till 10 centimeters and take it far. Do these eye exercises. But allopathically, we haven't seen them to prevent disease, just to release the strain.
And what about your special 2020 rule?
Oh, that is all people who use screens all the time. Every 20 minutes, take a break of 20 seconds and look far away. Once you look far away, you will notice that your own eyes, there's some relaxation happening, there's some stress being dissipated. And then go back to work. It is like if you lift a 1 kilo load, how long can you lift it for? 10 minutes, 15 minutes. You lift it for 1 hour. After that, muscles will be sore for a long time.
Exactly.
So if you give gaps, then you can lift it again. Similarly, you give gaps to your eyes, then you can work on the computer again. But you work at it, look continuously for 2-3 hours. After that, for a few days, you will have strain. Those frequent breaks every 20 minutes will go a long way in preventing the strain.
Thank you so much, Dr. Chaudhry, for joining us and sharing your expertise. Remember that regular eye checkup, balanced diet, and professional guidelines are essential steps towards preserving your vision. If you have further questions, please feel free to share with us. Until next episode, take care of yourself. Thank you so much. Don't forget to subscribe to my channel. Thank you.